Hey Paige, how you doing today?
Hey, I'm good. Thank you for asking.
Good. I'm Izzy, and I'll be your student physical therapist. Is it okay if I work with you today?
Yeah, of course.
Awesome. So before we kind of get started with any exercise or any kind of assessment or treatment, I just would like to get a little bit more of your history and just kind of get to know what brings you into the clinic today and kind of just ask you a few questions. Does that sound okay?
Yeah, that's totally fine.
Okay, awesome. So Paige, talk to me a little bit about what brings you into the clinic today.
I've been having mid back pain and pain in my left knee.
Okay, okay. Can you recall a specific thing that brought on the pain? I read that it was possibly work related, but just go ahead and tell me a little bit more about that.
I think my back pain was caused by lifting heavy boxes at work one day. And
Okay,
then for my knee, I had ACL and meniscus surgery repair when I was 17. So I'm thinking that just never fully healed.
okay. How long about can you recall did that incident happen, or have you had that back pain?
Uh, I can't remember how long. Maybe
Okay.
a little while now.
Is there a particular side that's bothering you on your back, or is it kind of specific to one area?
No, I would say it's just all around in the mid back area.
Okay. And for your knee and your back, what does the pain feel like? Is it achy? Is it burning? Is it kind of dull?
For my knee, it's just like a dull, aching pain and stiffness whenever I'm in one position too long. And then for my back, if you're wondering about that, it's a constant deep ache with sharp stabs with certain movements.
Okay. So on a scale from 1 to 10, 1 being kind of the best it can feel, 10 being the worst, how does your knee and your back feel right now?
I would say my back is at a 6, and then my knees at a 4.
Okay. Do any movement specifically make it worse? I kind of read a little bit about sitting at your computer, but is there anything else you kind of can tell me that makes that pain a little worse?
Yeah, I would say reaching out and overhead, like as if I'm turning to back the car up. And then it hurts whenever I sit at my computer or iPad for more than 30 minutes. And then there's really sharp stabbing pain whenever I'm trying to twist to put on my belt. That's
Okay.
probably the worst. And then with my knee, whenever I'm sitting or taking the stairs or just on my feet for more than an hour, that's whenever it's bothersome.
Okay. I see that changing positions makes your knee and your back feel better. What specific positions kind of have you noticed that helps alleviate that pain a little bit?
For my back, it's laying on my side and then taking a hot shower. And then with my knee, it's just in general changing positions and wearing my knee sleeve. That helps.
Okay. So I noticed you said kind of reaching, looking behind you, performing this motion, but is there anything else, kind of dressing, bathing, going to bed, getting up from bed that kind of is limited by the pain you're having right now?
I would say with bed, I, I can't sleep for more than 3 to 4 hours at a time because then I have to get up and move around. And then with dressing, I would say putting on my belt. That's the worst pain with it.
Okay, okay. And Paige, have you, or prior to your episodes of pain, were you physically active? I saw that you played bowling, but kind of talk to me about what else you like to do during your day.
Yeah, I guess I would classify myself as relatively healthy. I do like to be active. I have 2 kids and I love to play with them, but that's limited right now due to the pain. And then yes, I do have a passion for bowling. I do love bowling and unfortunately I had to give it up, but that was my thing.
Prior to the injury, how often were you bowling a week?
I would say 3 to 4 days a week.
Okay, I'm confident that we can get you back there.
Good.
And have you made any modifications to work because of your injury? Have you changed kind of what you're doing because of that back pain or knee pain at all?
I've had to take some afternoons off just because
Okay.
the pain is so bad, but that's pretty much it so far.
Okay. And I saw that you have some psoriatic arthritis. Can you tell me a little bit about that? Kind of how maybe the challenges you faced with it or how you've been managing it?
Yeah, I've had it for 6 years now, and you get symptoms with it, which is some it's inflammation, sometimes joint pain. But I would say for the most part, it's well handled. I really try to stay on top of it.
Okay. So it doesn't really necessarily limit you from doing a lot of things currently.
Nah, not too bad.
Okay. Okay. And Paige, I wanted to talk a little bit about that little issue with your left elbow, kind of that issue going on with our skin. Um, when did you notice it?
I would say it happened a couple weeks ago.
Okay.
Just one of the signs of having PSA, but I've been really taking care of it, staying on top of it to make sure it doesn't worsen or become infected.
Okay. So it doesn't cause you a large amount of discomfort or limit you from doing anything right now currently?
No.
Okay. And Paige, have you ever had physical therapy before?
No, this is my first time, so I'm curious about it and hoping that it works out.
Yes, I'm confident that we can definitely help you. So, Paige, what would you say is just kind of overarching your goal for coming to physical therapy?
I would really like to get rid of the pain as much as possible, if not all of it. Like I mentioned, I have two kids and I would like to be able to get back to playing with them. And then I would love to get back to bowling since that's my passion.
Okay, well, that's wonderful. I definitely feel that we will be able to help you. Do you have any other questions for me?
No, I'm good. Just looking forward to physical therapy and seeing what it entails.
Okay, well, I'm looking forward to working with you too. So, kind of just want to give you a brief overview of what's going to happen next. We're just going to perform some basic strength and look at the range of motion of some of your muscles, okay, both in your back and kind of surrounding that knee. We also might test and look at the function and making sure our nerves are working well. And then I'll give you a couple exercises that you can start with at home, and we will get your treatment plan going at any time. If you're experiencing any pain, just let me know and I'll get you taken care of, okay?
Okay, sounds good. Thank you, Izzy.
Yes, of course, Paige.